President of the Republic of the Philippines.
Thank you. Thank you. Please down. Dr. Shin Young-soo, Excellencies of the Diplomatic Corps, Corps Secretary Aquino, representatives from international organizations present, officials and employees of the World Health Organization, fellow workers in government, honored guests, ladies and gentlemen, good morning. During my campaign for the presidency back in 2010, I had occasion to visit the Baseco compound, one of the most depressed areas in the National Capital Region. There, I came across a young woman who, at 16, may I repeat that, who at 16 was already a mother of two. Many questions raced through my mind, given that the father of her children could barely eke out a living as a pedicab driver. How will they be able to afford food, milk, or diapers for their children? If their kids do not receive enough sustenance during their formative years, the most integral part of a brain's development, will they not enter schooling already at a disadvantage over their peers? For a family that can hardly afford their day-to-day needs, wouldn't a serious disease be akin to a death sentence? That young woman has embodied for me the challenges that confront the health sector, and the crippling status quo that led her to have a third child in the span, I believe, of just 2 years later. Her image, as well as those of so many others who had been bound to share her fate, stood as a reminder of what I had to do to translate our vision into tangible realities for our people. This is what I believe in. I believe that every Filipino life, every human life, holds equal value. I believe that there is something inherently unjust when a child growing up in Baseco cannot enjoy the same opportunity to live a productive, healthy life as those of us here in this conference hall. I believe that 4 out of 10 Filipinos who die without ever encountering a healthcare professional in their lifetime is a number that is simply too high. Proper nutrition, proper access to healthcare, and an opportunity to build a dignified life. These should not be reserved only for those who have the means to pay for it. If we are to build a true regime of opportunities, then the most fundamental freedoms, the freedom from hunger, as my father said, the freedom from unease afforded us by a secure nation, and the freedom to actively participate in our democracy. These must all be extended to every citizen, regardless of the circumstances of their birth. And so we set to work. With the help of allies and advocates, we pushed for legislation that would ensure that the status quo of unequal access to resources and knowledge would change. It might have taken a grueling political battle against entrenched interests. But in December of last year, finally, after languishing in Congress for so long, both the Responsible Parenthood and the Sin Tax Reform Acts were signed into law. From a mere afterthought, a mere impossible dream, the prospect of true universal health care is now within sight. 86% of our people are now enrolled in PhilHealth, with the lowest quintile of our population already benefiting from our no-balance billing policy, which allows them to get treated in government hospitals without shelling out a single peso. And while implementing healthcare reform is a matter of compassion for those who have for so long been relegated to the margins of society, it is also a matter of strategy. A healthy citizenry is a productive citizenry. The people whose health we are investing heavily in are the same people who will man workstations, till the fields, power our industries, and fuel further economic growth. Children who are inoculated from disease and who get proper nutrition in their formative years will go to school more capable of learning the skills necessary for higher value jobs as they enter the professional world. Spending less money on medicines and checkups means more money towards savings or books for their children, or even investments that can drive the business sector and generate jobs for more of our countrymen, sparking a virtuous cycle of opportunity and inclusive growth. We are implementing this strategy of empowerment through focused government spending. You are perhaps familiar with the fact that the Department of Health's budget has increased by 78% since we took office. Allocation for the Department of Education, the biggest component of our budget, has also likewise increased by 44%, while the budget of the Department of Social Welfare and Development has jumped by a staggering 268%. With our flagship conditional cash transfer program increasing its coverage from 800,000 indigent households to more than 3.8 million indigent households to date. An initial study of its impact shows encouraging results. More poor mothers receiving antenatal care at a more frequent rate, reduced severe stunting among children, and better feeding practices for children were among the findings that inspire further commitment to the program. The budget surges for social services were all implemented not by increasing taxes, but by ensuring that corruption is weeded out from the system, and that the hard-earned money of our taxpayers goes to where it should. We call this the 5 R's of prudent government spending. The right project managed by the right people who will ensure the right quality and deliver it at the right cost and at the right time, cheaper and sooner than the public has come to get used to. This stands in stark contrast against the ways of the past, when staying in power was the bottom line of being in power. Then the question you were most likely to encounter when dealing with government officials was, what's in it for me? Now the single most important question in the decision-making process is, how can we better serve the people? 25 years ago, when you bestowed upon my mother the honor of addressing you during World Health Day, the Philippines was still reeling from the memories of martial law. The indignities that our people suffered under the dictatorship were still fresh in our minds, and we had just begun to regain our footing as a free nation. I believe you chose my mother to address you then because of what she represented. A people that valued life and saw that compassion was the most powerful weapon against injustice and oppression. The belief that we all had a duty to protect and care for the most vulnerable members of society. These are the same bedrock principles upon which the World Health Organization was founded 65 years ago. Principles you live up to this day. As you continue the important but sometimes thankless task of pursuing, as you state, and I quote, the attainment by all people of the highest possible level of health, close quote. Today, I accept this honor with deep gratitude, knowing full well that it recognizes not the triumph of a single entity against seemingly insurmountable odds, but the strength of a people, willing and eager and fervently working towards change. It is an affirmation of an entire philosophy, an appreciation of the shifting culture of governance in the Philippines. The laws we were able to pass, the reforms we are seeing in the healthcare sector, all of these emanate from our staunch resolve to reinstitute integrity in government service. I have no doubt that in the future we will be seeing as an everyday reality the fruits of the change we are striving to achieve today. As early as now, we can see it sprouting in the undergrowth. We see it in a chef who, after spending 24 years in America, decided to come home permanently to the motherland. We see it in the graduate who, despite a family that sourced its entire income from gathering palm wine, can now look forward to a distinguished military career after finishing at the top of his class at our military academy. And we see it in every mother, grateful that her child can now look forward to a healthy, dignified life of opportunity because now she has an entire nation on her side. Thank you and good day.
Thank you, Mr. President.